first cranial nerve is the olfactory nerve. It's a sensory nerve that is responsible for the sense of smell. So for this one, we would just ask the patient if they are able to smell something. The second cranial nerve is the optic nerve, which is a motor nerve that is responsible for the visual acuity. For this one, you are going to have the patient read a visual eye chart. You're going to have them stand about 20 feet away, and you're going to have them cover one eye, and then you're going to have her read down as far down the chart as she can, and then she's going to switch eyes and do the same thing. The third cranial nerve is the ocular motor nerve, which is a sensory end motor nerve, which is responsible for eye movement, especially when looking at the pupil. So for this one, you're going to take a pen light, and you're going to cover one eye. You're going to shine the light in her eye and take it away, and you're looking for her pupil reactions, and you're going to do that to both sides, and then you're also going to have her trace your finger. And if they're seeing double further away, then you know that there's a problem. The fourth cranial nerve is the trochlear nerve, which is a motor nerve that is responsible for eye movement inwards, and to test this, you're going to have her trace your finger in a bow tie. The fifth cranial nerve is the trigeminal nerve, which is a motor and sensory nerve that's responsible for the sensation of the face and some facial movements. So for this one, to test it, you're going to ask the patient if they can feel when you touch their face.
Yeah, I feel that. Yep, your fingers are cold. Yep.
And then for facial movement, you're going to have her clench her jaw down and then open, and don't let me close. Good. The sixth cranial nerve is the abducens nerve, which is a motor nerve that's responsible for eye movement outwards. And for this one, you're going to also do a bow tie and have her trace your finger. The seventh cranial nerve is the facial nerve, which is a motor nerve that's responsible for facial expressions. So to test this one, you're going to ask the patient to smile, frown, and you're just looking for symmetry between each side of the face. The eighth cranial nerve is the acoustic nerve, which is a sensory nerve responsible for hearing and balance. To test this one, you're going to cover the patient's one ear, and you can either snap, hear that, or you can also whisper something in their ear, and then you're going to do the same to the other side. Yep. And then you're also going to perform a best test. The ninth cranial nerve is the glossopharyngeal nerve, which is a sensory and motor nerve that's responsible for taste and tongue movement. To test this, you would ask the patient if they can, you'd give them something like salt or mustard and ask them if they can taste it. And then you're also going to have them stick their tongue out. And you're going to be looking for symmetry between either side of their tongue. The 10th cranial nerve is the vagus nerve, which is a sensory and motor nerve that is responsible for the sensation and movement of the internal organs. Some ways that you can test this would be you could have the patient swallow some water, or you could have them cough. So, cough. Corona! The 11th cranial nerve is the spinal nerve, which is a sensory and motor nerve, which is responsible for muscle strength. To test this, you're going to have the patient do a resisted shoulder elevation and also resisted neck rotation. So push up. Good. And turn your head to the right. And relax. And other way. Good. The 12th cranial nerve is the hypoglossal nerve, which is a motor nerve, which is responsible for tongue movement. And to test this, you're going to have the patient stick out their tongue and say, ah. And you're looking for symmetry of the tongue.